Good afternoon, everyone. Welcome back from lunch. I hope you had an enjoyable moment to eat something before our next session. This is the Keynote session, Student Homelessness is a Solvable Problem. And my name is Diane Elias. I work at Minnesota Housing. I manage several programs that are utilized to prevent and end homelessness, and one of those is a Homework Starts with Home program. And so I'm really pleased to be your moderator today. Just a couple of reminders that please remember to mute yourself so that we can experience some good audio quality. And then during the presentation, you can use the chat to ask questions, which is on the right-hand side of your screen. And then after our presentation by Dr. Morton, we will open it up for questions and answers. So I will introduce Dr. Morton now. I'm really pleased to introduce Dr. Morton. He has pronouns he, him, and his, and he's a research fellow at Chapin Hall, at the University of Chicago, with expertise in youth empowerment, homelessness, and evidence-based practice. He served as principal investigator of Voices of Youth Count. That's the most comprehensive national research initiative to date focused on youth experiencing homelessness in America. Matt has led numerous other studies and evaluations on youth development, youth homelessness, and related topics both in the United States and internationally. Matt has held several positions, including at the World Bank, the U.S. government, in philanthropy, and with youth-serving nonprofits. While working in the federal government, he was a key contributor to the development of the U.S. government's national strategy and framework to end youth homelessness. And Matt currently lives in New York City. I was reminded that Matt did a presentation at the National Alliance to End Homelessness during one of the sessions, and I always compare those sort of later keynote sessions to seeing Richard Gere at one of those National Alliance to End Homelessness conferences. And so he was just as entertaining and interesting to participate with during that session. So I think you'll be pleased to meet Dr. Morton. So Dr. Morton, please take it away.
Hi, good afternoon, Minnesota. Thank you so much for this opportunity to join you today in a really important conference on ending student homelessness. This is really important to me and to the work that we have done at Chapin Hall over the last several years, and just delighted to be part of this conversation with you. So thank you very much. My talk today is based on a pretty simple premise, and that is the proposition that student homelessness is a solvable problem. At Chapin Hall, we've published a series of publications, starting with the header, Missed Opportunities. And these research publications have highlighted that, in fact, we have missed so many opportunities throughout our country, throughout public systems, to disrupt young people's pathways into homelessness, avoidable pathways. And I think that is, while that's true, it doesn't really have to be that way. And our research suggests ways in which this really could be avoided and confronted. And you all, educators, people who work in education systems, and the people who work with and inside of education systems, play such instrumental roles in disrupting those pathways, those missed opportunities for preventing and ending student and youth homelessness. So I'm just so excited to have this opportunity to engage with you, and I'm so thankful for the work that you do. In the United States, I believe we've come to accept homelessness as some kind of immutable reality, a fact of life, if you will, something that just can't be changed. It's a tragic, but it is the way it is. I don't think that's what we have to accept, and I don't think that we should. In fact, I believe that youth and student homelessness really is a solvable problem, but it's a matter of our priorities. It's a matter of using good data. It's a matter of centering on people with lived experience and expertise and on racial equity. And it's a matter of moving more upstream and into prevention and early intervention. And you all play such key roles in that. So my talk today is really going to focus on those parts of the puzzle of ending student homelessness. Now, we tend to think a lot about the importance of the first 1,000 days. I think that's pretty well integrated. I'm sure you all are very familiar with that frame, and I get it. This is Caden, also known as Simba, many days of the week, and Caden is my newly 4-year-old child, and I could see in this development of a toddler just how important that transformation was. In the first 1,000 days, he'd gone from saying no to no way. That was a really important milestone for us. He would dress up in his Simba costume every day pre-COVID and go on the New York City subway with me often at rush hour and belt out pretty much every Lion King song known to humankind. And he would challenge the notion that I'm a real doctor. If only PhDs came with a lab coat, then that would show him. But I get it. This first 1,000 days of development and importance is so important for the brain and what happens in our lives and that transforms our futures. Unfortunately, I don't think we apply the same degree of importance and significance to the developmental period that happens during this stage, adolescence and young adulthood. Although this is unfortunate because we do know now so much neuroscience and literature from the last 15 to 20 years that this stage is just as important for the development of the human brain and for the trajectories that we all go on in our future. And so I want to just sort of start with a little bit of framing about the importance of thinking about these issues specifically for students and adolescents and young adulthood. First, we do know that from this neuroscience literature that adolescence and young adulthood is indeed a really critical developmental period. The brain goes through a whole new level of reorganization that affects our social and emotional competencies throughout our lives. If that's a period that's spent in housing instability and related trauma and adversity, that is going to affect our trajectories in really negative ways in the ways that our brain develop, especially around social emotional competencies and emotional regulation. If that is a period that's nourished and empowered and offers experiences for mastery, development, and skill development, then that can affect our trajectories in very different ways. Second, during youth and young adulthood, homelessness tends to be especially hidden, especially because we see more forms of couch surfing and doubling up during this period, which means it's all the more invisible. And young people often don't want to be seen as experiencing homelessness. In the age of Instagram and Facebook and public image being so important, these issues come into play even more in how young people and when young people identify as experiencing homelessness and housing instability. Third, we know from research now from other countries and increasingly in the United States that the single most common pathway into adult homelessness is youth homelessness. The single most common pathway into adult homelessness is youth homelessness. It's not eviction, it's not domestic violence, it's not substance use. All those issues can come into play, but the most common pathway is youth homelessness. That's really critical because it means if we care about ending the homelessness crisis in our country overall, we have to care about going earlier with students when they are children, adolescents, and young adults, and engaging the causes of their future housing instability. And then finally, there are different policy and program levers. Think child welfare, think juvenile justice, think after-school programs, think schools and education. So this makes addressing homelessness especially unique and important during this period and calls for tailored solutions and thought processes about how we engage. Now, I want to also say that this comes with some personal significance. I am a nerd. I'm a researcher. I like long walks on the beach and evenings of designing unbiased sampling strategies. But I am also, I also come to this issue with some personal experience and passion about this topic. I myself was a lucky youth. I had runaway experiences when I was young. I did lose both of my parents when I was a child and a young adult. I grew up in a household full of instability, substance use, chemical dependencies, mental health issues, you name it. At the same time, I was lucky because when I was 15 years old, a high school English teacher spotted potential in me when others didn't, when I didn't spot that potential in myself. She thought I wasn't being challenged enough, so she helped to get me into more aggressive classes, because she could see that even though my grades weren't that positive, that I was engaging academically with reading and with writing, because that for me was an outlet. That was a way for me to express the challenges that I'd been going through in a way that was safe, without actually talking to somebody explicitly about what was going on in my life and in my household. And she also happened to be a volunteer with a community group of adults who were supporting young people in low-income communities in setting up a first youth teen center as part of Hillary Clinton's Millennium Celebration when she was First Lady, which charged communities across the country to do something positive. In our community, young people decided that they weren't going to just plant a tree or paint a mural, but they were going to start a teen center. And not just any teen center, but they wanted young people to run it. They wanted young people to do everything from painting the walls to hiring and firing adult staff. Now, you want to see a nervous adult, put them in front of a panel of 16-year-olds who are in charge of your hiring and firing. It was quite an experience, but the adults who made it through, we knew really believed in our agency and our empowerment and the power of young people and what we could do for our own community. And that model became a teen center that first got a grant for $200,000, and then I became chair. It was an incredibly empowering experience for me. My teacher brought me to this teen center, and for the first time in my life, I felt like I had an opportunity to turn my pain into a passion, into something positive for my community. I saw other young people who all had different adversities, but were expressing their resilience in a common pursuit of building a youth-driven teen center. And then a family foundation entrusted us further with another $1 million to build out 4 other teen centers like it. And at 17, I was asked by the White House to give the keynote address at its first National Youth Summit in Washington, D.C. And that launched me very quickly as an introvert in Florida into a national advocate on runaway and homeless youth issues and youth empowerment. I raise this story because while I was very lucky because of somebody who intervened earlier inside of the school system in my life, not everybody's so lucky. And the unlucky ones remain invisible. And that's what brought me into research. I want to share one example shortly. So this is me and my teen center and my teen center group and my colleagues who joined me. Don't mind the necklace or the clothes. This was Florida in the early 1990s. But this was our group, and this arrow points to Miss Littman, my high school English teacher. And then these are the other youth and adults who partnered together to create this teen center. But I also want to highlight, that not all young people really do become so lucky. Take this youth, for example, who I spoke with over the last couple of years. This person says, I was sleeping on the streets before I got arrested, sleeping in a bus station or in motels when I could. I took drugs not to think about it, not to think about the fact that I might not have a place to stay, that I might have to sleep on the street. I'm ashamed of it. I just wanted stability. I didn't have anything stable, anywhere stable to live. I just wanted stability. This quote happens to be from my little sister, who experienced chronic homelessness, and literal homelessness in shelters on the streets and in unsafe couch surfing situations over many years, and still is struggling to prevent future housing instability, who has been incredibly resilient. But goes to show that in even just my family's experience, you can have divergent pathways, because we do have a nation in which we don't have a safety net for everybody. We have a safety net. We have a situation in which some young people get lucky and some young people get unlucky. And that makes me angry that we have a nation in which we have any such thing as lucky and unlucky youth. And it makes me angry that those unlucky youth tend to remain invisible, and that they are disproportionately youth of color, and they are disproportionately LGBTQ identifying young people. So I got into research because I believe passionately that good data, good evidence can help make the invisible visible. It can shed light on our blind spots and challenge us to focus on areas that might be difficult or that might be unseen to us or as a society or individuals. That can help us make better policies and practices. So that impetus led me and my colleagues to develop a national research framework on youth homelessness, and Chapin Hall, in the spirit of making the invisible visible, has led Voices of Youth Count, the most comprehensive national research initiative to date on youth homelessness in America. I won't go into the details of Voices of Youth Count today, but I'll share some glimpses of what we've learned. All of our publications, all of our resources are freely available on Chapin Hall's website and on voicesofyouthcount.org. And I encourage you to use it, read it, share it, make fun of it, whatever it takes. Just build a dialogue around this research and data. Use it in your communities, in your schools, in your systems to have a conversation. We've also published specific briefs on education in youth homelessness and on specific issues like pregnant parenting youth, rural youth homelessness, LGBTQ youth homelessness, and we have an evidence review of programs and practices. All of this is yours to use, and we'd love your feedback on what's helpful and what's not. But at the high level, we conducted the first national survey of youth homelessness to date on the prevalence and incidence, and the results were startling. We published these a couple of years ago, and they've already been instrumental in influencing congressional policy and federal policy. We found that in this national survey, about 1 in 30 adolescent minors between the ages of 13 to 17 experienced some form of homelessness within a 1-year period. When we looked at young adults, that prevalence climbed even higher. About 1 in 10 young adults experienced some form of homelessness within a year. About half of those were experiences of couch surfing or doubling up without a safe and stable living arrangement, further underscoring the extent of hidden homelessness during this critical developmental period. We also found that youth homelessness is not an East Coast, West Coast issue. It's not an inner city issue. Youth homelessness as a proportion of the population is just as prevalent in rural America as it is in urban areas. And that's really important because it really reinforces how much of a national challenge this is and one that needs to be grappled with everywhere. But just because rural homelessness is just as common as urban homelessness as a share of the population doesn't mean it looks the same. In fact, we found that youth experiencing homelessness on a given night in small rural counties, based on our brief youth surveys, were about half as likely to be staying in shelters, which makes sense because the shelters often don't exist, or they're not youth friendly, or they're hours away by driving in rural communities compared to urban communities. And they were twice as likely to be staying with others, couch surfing and doubling up and such. They're also more likely to be in unsheltered homelessness situations, but even those were more hidden, with youth staying in remote places or in cars or in stairwells and so on, in ways that were harder to identify. The research also critically underscored the importance of centering on equity and racial justice if we're really to end student homelessness and to take this problem seriously. Our survey results found that among the different racial ethnic groups, American Indian or indigenous young people had the highest prevalence of homelessness among all groups of young people, followed by Black and Hispanic identifying young people. We also found a really important intersectionality between sexual orientation, gender identity, and race and ethnicity. For example, if you were a white, non-LGBTQ identifying young person, the prevalence rate among your subgroup was about 4%. But if you were either Black and non-LGBTQ or white and LGBTQ, your prevalence rates of homelessness or your risk of homelessness was about twice as high. If you were a young person who identified as both Black and LGBTQ, you had 4 times the risk of homelessness as youth who were white and non-LGBTQ identifying. So the intersectionality of these identities and how they put young people at risk for homelessness because of legacies of systemic oppression and racism and discrimination are really important for us to grapple with in policy and practice and in school systems as we try to address this issue. And these disparities are only being exacerbated by COVID-19. I think we all recognize that intuitively, but we're only just now getting the data to reinforce this. So far, the narrative has been about racial disparities in health outcomes among older age groups. But now a colleague and I at Howard University named Gerald Daniels are just starting to look at Census Bureau survey data that's been coming out around COVID-19. And what we're starting to see is that the racial disparities are greatest among young people, young adults, when we look at other non-health indicators, like this indicator of a lack of confidence in the ability to pay for next month's rent or mortgage, reinforcing that housing instability and racial disparities in housing instability are only being exacerbated by COVID-19, and this is particularly acute for youth and young adults. The work that we've done also really reinforces the importance of moving more upstream. We can't end youth homelessness without preventing it. We cannot end student homelessness without preventing it. For decades, our response to youth homelessness, the youth homelessness crisis in our country, and in fact, the homelessness crisis overall, has been largely shaped by something called triage. I'm sure many of you have heard this term, but let me just start by saying that triage is not in and of itself a bad thing. In fact, it's necessary. When you have too many people in need and not enough resources, triaging is about making sure that you prioritize or you triage who gets which limited resources first. That's a simple fact of scarcity, and it has to be done in some form or another. But there are a few things that are very wrong with the fact that we have to rely on triage so incessantly throughout our homelessness response systems. First, I challenge the premise of scarcity to begin with. How many people actually believe that in the richest country in the world, that we can't afford to solve homelessness if we really wanted to? Some of the most directly relevant federal programs and expenditures for this population for youth homelessness include programs out of the Department of Health and Human Services from the Runaway and Homeless Youth programs, out of Housing and Urban Development, especially the Youth Homelessness Demonstration Project, and out of the Department of Education in the form of the Education for Homeless Children and Youth Act. When you take those three main federal programs that are focused on youth homelessness in particular and dedicate resources to this issue, and you combine all of them, it's still less money than our federal government spends on a single B-21 aircraft bomber. Just keep that into perspective. This issue of scarcity, the fact that we have to triage a few housing resources for a large number of young people and families who need housing resources, is not an inevitable, immutable fact of reality. It's not because we don't have enough resources, it's because of our priorities for how we use the resources that we have as a nation. Second, let's remember that the term triage comes from a history of war. Let's think about the context that this term comes from. Triage emerged out of a necessity of war. The picture here shows an early example of medical triage during World War I, when the French had popularized the term. You had too many bloody bodies strewn all over a battlefield, and immediate medical attention was needed. So what could they do? They had to triage who needed to be supported with immediate medical attention first. But treating triage and crisis response alone as the whole of the system to end student homelessness would be like treating an emergency room as the whole of a healthcare system. It just doesn't make sense if the goal is to end the problem. We shouldn't be at war with homelessness anymore. We shouldn't be at war with homelessness every single year. We should be reflecting on why the war exists and doesn't go away and working to end the war. And we have to do that. We have to do that by challenging the legacies of racism, the unaffordable housing markets, the unprecedented levels of student debt, the lack of investment in high quality and equitable education and thriving communities, and the lack of social safety nets that are sending way more young people into homelessness every year than our homelessness systems could possibly handle, and even if you doubled or tripled their budget. Why aren't we challenging the sources of the inflow? We have to ask ourselves, do we really believe we can end youth homelessness with triage and crisis response alone? Or do we as a nation believe that we can and must move more upstream? At Chapin Hall, our research has really underscored the importance of a more comprehensive approach. And this is the approach that we've been taking with systems and policymakers based on the research that we've identified. Of course, a better crisis response system is needed. McKinney-Vento school liaisons need more supports to address the crisis that young people are in. Shelters and housing resources have to be available for them when they meet that point of crisis. But unless we start thinking about the front end of prevention and the back end of helping to ensure that young people and families have resources for stable and sustained exits from homelessness, we are not going to end student homelessness. And the important thing about this perspective is when we think about crisis response, the homelessness systems and services play the leading role. But when we think about prevention and stable exits from homelessness, the homelessness system is a complementary or a supplementary group, and their services are supplementary resources, but the leading actors are public systems that play bigger roles upstream, and those include schools, child welfare systems, legal systems, behavioral health systems, among others. So you all play really the leading role when we go into the front end and the back end of this system. This has to be done because we cannot end homelessness with the resources that we currently have. Our research and analysis of administrative data of homelessness system data across 16 communities shows that only about a third of young people who even come into coordinated entry homelessness systems in their communities ever get a housing placement. And among that third of young people who get a housing placement in rapid rehousing or supportive housing resources, they tend to wait about 4.5 months just on average to get into a housing placement. And every additional day of waiting is associated with a 2% decrease in a young person's likelihood of staying stably housed. So these waits are causing harm. So the main message here is that we really do have to move earlier. We need resources for young people who are also at risk for homelessness or early in their homelessness experiences so that we're not waiting for them to reach these scarce needs for resources at the point of deep crisis. We also know, based on our in-depth interviews with 215 young people, that about 1 in 4 youth we interviewed had prior experiences of family homelessness if they had unaccompanied homelessness, underscoring how interconnected youth and family homelessness or accompanied and unaccompanied homelessness are. And about 3/4 of youth experiencing homelessness as young adults had experiences of homelessness when they were children and adolescent minors. So we're missing these pathways, these opportunities to engage so much earlier, and we really have to take advantage of these opportunities, and schools play a really key role. Education has such a crucial role in this for so many different reasons, but I want to just highlight a few and underscore why your role is so important. First, I want to share these results from the national survey that we conducted a couple of years ago. Is the same national survey that produced our prevalence and incidence findings, but we also tried to understand what factors or characteristics were correlated with a higher risk for young people experiencing homelessness, in this case, young adults. And you can see a whole bunch of different factors. This is called a forest plot. The diamonds that are gray or colored in are the characteristics or factors that were statistically significant. In fact, that means that they had a significant relationship with the experience of homelessness. The other ones that are not colored in weren't significant enough to be able to be called correlates or risk factors for homelessness. Of all of the factors that were correlated with homelessness, the single characteristic that had the strongest correlation for homelessness among young adults ages 18 to 25 was the lack of a high school diploma or GED. Those young people had 4.5 times the risk of homelessness, of experiencing homelessness, as young people who had at least a high school diploma. We also know that the relationship between education and homelessness is bidirectional. Not only, just like I just said, were youth, young adults who lack a high school diploma 4.5 times at risk of experiencing homelessness, but also homelessness is a risk factor for lower educational attainment. Young adults who experience homelessness were less than a third as likely to be enrolled in four-year college as stably housed peers. Now, these points don't mean that the lack of a high school diploma causes homelessness, or homelessness causes a lower education necessarily by itself. It means that these points, that school dropout or school retention and homelessness these outcomes share common underlying risk factors. And it makes sense for us to be addressing them together, simultaneously, with strategies that treat these not as isolated issues, but as issues that are deeply interconnected and warrant a common strategy, common sets of resources, common identification processes and policies and resources. When we think of homelessness as, and the need to address homelessness as a systemic solution, our research shows that a comprehensive approach to preventing and ending youth homelessness really does depend on education. It depends on you. First, think of education as prevention. No high school diploma being correlated with a greater risk really underscores the fact that we have to go earlier in screening for both risk of school disengagement and homelessness earlier. And we can do that in schools to prevent both adverse outcomes. Second, think of education as a pathway to stable housing. Education's contribution to stable housing is largely related to the importance, for example, of adequate income to sustain housing stability over time. Economists call this an education premium. In fact, bachelor's degree holders can expect to earn 168% of wages received by those with only a high school diploma or education. And advanced degree holders could expect to earn 213% more as those who don't have an advanced degree. So putting young people and keeping young people on a path to higher education gives them the opportunity, a better shot at affording housing in the context of stagnated wages for low-income workers and increasingly rising housing costs in an unaffordable housing market. And I'm really excited to share that even here in Minnesota, we have partners who have taken big, bold steps with us at Chapin Hall and local partners to try and experiment with something different, to show what's possible. And I want to really thank particular leadership. So we have been working to adapt a model from Australia that in Australia was called the Geelong Project. And it involved a bold principle or set of principles to work with schools and community-based organizations to conduct universal screening for risk for homelessness and school dropout among students in the 7th to 12th grades, and to connect those students and their families with supports and services before they reach the point of crisis. And the Hopkins Public Schools have partnered with us in delivering and adapting this model locally in Minnesota, and we're also working with community in San Mateo County in California. And we've been working with Move Forward as a community-based organization partner in Hopkins, Minnesota. And in particular, this really starts with leadership. So much of this begins with leadership, to be able to try something new, something bold that takes us beyond the status quo. And in the case of Hopkins, it started with a school board member, Chris Latondras, now just elected to the county commission. With Superintendent Dr. Rhoda Mary Puri Reed, Supervisor of Special Services Brian Stanley, and the PolEd Foundation providing support and partnership to this work. And when you have a group of leaders in the systems, in philanthropy, in schools, and in Move Forward, a nonprofit, to work together and see a vision for preventing and ending homelessness, really incredible things can happen. And we've already started to see that by initiating early screening in these schools, we've been able to double the identification rates of students even just currently experiencing homelessness by going beyond routine identification and conducting surveys in schools to identify those students who need support. And schools have been able to identify and engage students who aren't yet in a housing crisis, but are at risk for a housing crisis and are at risk for disengaging with school so that they can intervene with those families and those young people earlier. It's really important that we take steps like this to show what's possible, to change the narrative on what can happen. I want to just use one metaphor to illustrate this point. So I myself am an avid distance runner. I've been running since I was about 13, 14 years old myself. This is me last year in the New York City Marathon. I've been, before COVID, running many races, and this is my Simba celebrating the end of the marathon with me. And this has been with me for a long time. So set against this backdrop, you might imagine the geek neurons that activated when I joined the University of Oxford's running team, where I did my PhD in grad school and trained weekly on the same track where Roger Bannister broke the first 4-minute mile in 1954. I even got to meet him briefly while I was a student there. Now, why does Roger Bannister in this old photo matter? Well, for a long, long history of competitive running, no one could manage to break the 4-minute barrier for 1 mile. Many actually thought it was just unattainable. Your heart would physically explode. Some doctors thought if somebody tried to break the 4-minute mile. And yet in 1954, one runner had gotten down to 4:01, so got very close. And no one thought that they could break that barrier until Roger Bannister. But on one blustery English day, Bannister ran a 3:59 mile. Less than 6 weeks later, someone else ran 3:58. Within the same year, the 4-minute mile had been broken twice more. In the following decade, many athletes would run sub-4s. More recently, during 2017 alone, 93 people ran sub 4-minute miles, and the world record now stands at 3:43. Roger Bannister showed what was possible, and he opened the floodgates for other athletes to do the same. This type of feat was achieved recently again. Much more recently, just this last year at a special event in Vienna, 34-year-old Kenyan Eliud Kipchoge was the first to break the 2-hour marathon distance of 26.2 miles. Many have compared this moment to Bannister's achievement in 1954. Like the 4-minute mile before when Bannister broke it, many speculated that it was physically impossible for decades, that it would be that somebody could actually break a sub 2-hour marathon. So I just want to dissect what happened in this experience that many thought would be physically impossible. First, Kipchoge defied the barrier. In joining with raw talent and incredible effort by having a group of colleagues that worked with him. First, he had pacers. Kipchoge's feat was assisted by a team of 42 other runners representing some of the best athletes in the world. The pacers worked in teams, rotating in twice. During each of the course's 6-mile laps. And the pacers were not only world-class runners, they were Kipchoge's friends. Their involvement really was recognized as crucial to his success. And Kipchoge would himself say that his effort was not an individual achievement. It was achievement of all of this group and so many more that were involved. Second, he had really cool shoes. The Nike Vaporfly Next Percent, which economize running efficiency. They've got carbon fiber plates. Anybody wants to know what to get me for my birthday? This is the shopping list. They're cool. They had fluid chambers that just made running a little bit lighter, easier, and more efficient. Third, he had an amazing lifelong coach, Patrick Sang, a fellow Kenyan who is regarded as one of the finest endurance coaches in the world, but not only nurtured Kipchoge's athletic talent, he also guided him through life difficulties and advocated for his needs holistically. Fourth, Eliud Kipchoge had data. He had a car that set out in front of them, keeping the pace as an electric car that didn't put out any fumes. It projected a system of lasers presenting visual data with the pacers so that they had that data to calibrate their pace every single moment. And yet, while many people will focus on these interventions during the run, Few people talk much more about the even bigger driver of Kipchoge's success, which is the fact that he had to do a great deal of deep preparation. To prepare for the event, Kipchoge was running 140 miles per week at high altitude. This is the long, hard, monotonous work that isn't very sexy to talk about, but it's arguably far more important to his success than his shoes. Otherwise, all of us would be sporting new kicks and running 4-minute, 34-second miles, 26 miles in a row. I wish it was that easy, but I have to say it's not. So taking these things together, it's easy to see breaking the 2-hour marathon didn't just happen. It wasn't just wishful thinking, and it wasn't an accident. We can break barriers, but we have to be intentional about how we go about doing it. And I just want to come back in this instance to the upstream model. This now might look a little bit more familiar. So the upstream model to preventing student homelessness and school dropout is really premised on a very similar set of ideas. First of all, it involves community collaboration. It recognizes that we can't actually prevent and end student homelessness in any one system, in any one institution, with any one actor, but it really requires coordination of different entities working collaboratively together. Just like Kipchoge had his 42 pacers, schools need community services need schools, they need funders and philanthropy and justice and legal systems and behavioral health systems all working in concert together to really work to prevent and end youth homelessness in a holistic way, understanding the complex drivers of homelessness emerge from failures and issues that come through multiple public systems. Second, just like Kipchoge had his cool shoes, cool tools help. We use a validated universal screening tool that we are working to improve constantly with better research and data. That's a survey that helps us go earlier to make sure that we're not just waiting for students to come into such a deep state of crisis that they become almost impossible to ignore. We're trying to identify students earlier through research-based tools and resources that allow school staff to connect with those students with services before they come to the point of crisis, so that we're avoiding unnecessary trauma and costs that come with later and deeper engagement. Third, just like Patrick saying supported Eliud Kipchoge's success holistically, young people, students and their families need advocacy, housing, and supports through case management, peer supports, and people who will be advocates on their behalf. I had Miss Littman. I had an English teacher who happened to be the right person for me in the right place in the right time, and others who came into my life, but that was accidental. So many young people don't get that lucky. We need these sorts of supports to be systematically provided in school systems and in communities for all young people who need it and their families. And fourth, using cool data, or using good data, but also cool data, and collecting good data is really critical. We capture data every year, we track trends, and we look for equitable results so that we can calibrate the work over time. But first and foremost, and most importantly, just like Eliud Kipchoge had to run that 140 miles a week in high altitude and tough terrain, the hard work for us, the work that doesn't get all of the attention, is the deep work of working for racial justice and housing justice and equity in our communities, and the hard conversations that have to happen, and the transfer of power to people who are powerless in their communities and have been historically disenfranchised. They are the ones who can navigate their solutions for themselves, and we need to put them front and center in navigating the solutions and directing the solutions for their schools and their communities to prevent and end youth homelessness. I just want to end by thanking you for making this issue a priority. I truly believe we can end youth homelessness. I believe we can end student homelessness, but this belief is contingent on our shared ownership of this challenge. We really can't end student homelessness without you. Because if not you, who? Because the problem is too broad and hidden to tackle without you. Because education is crucial to breaking the cycle of homelessness. And because there should be no such thing as an unlucky youth. Thank you for all that you do, and have a great conference.
Hello, everyone. Thank you so much for a powerful presentation. We saw a lot of hand clapping in the audience area, so thank you again. We now have an opportunity to have some questions and answers. So I will probably pose the first question, but I just want to remind folks that they can enter their questions in the chat feature as well as make a request to use the microphone. So to start, how do you make an extra effort to center and amplify the voices of people experiencing homelessness in your work? I know there can be barriers in this regard, and can you share how you overcome those obstacles?
That's such an important question, and I am so glad to be starting with it. It's so fundamental to the work. I don't think it's an add-on. I don't think it's a nice to have. I think centering people, in our case, young people with lived experience and expertise of homelessness, is absolutely essential to devising strategies that work. As a researcher, we work to build and develop better evidence, research-based evidence on preventing and ending youth homelessness. But evidence only informs decisions. It doesn't make decisions. And that's where people with lived experience come in. We need people with lived experience to help us decide what research questions to ask, what's so important, how to interpret research, and how to make better policy decisions with where the evidence takes us. And in our work, it's also been really important to engage young people as full partners in producing and conducting research and translating research to policy action. And I have to say, we're like everybody else, trying to learn constantly how to do that better and better. And the more we want to engage young people who are historically disenfranchised, the more we have to think about the systems of support and the barriers for them to be partners in the work, and make sure that those barriers are addressed so that they can be full partners, and that they're not tokenized, and that they have meaningful roles in partnerships. So in our work now as a practice, in virtually every research project we have on Chapin Hall's End Youth Homelessness team, not only do we collaborate with youth action boards and, of course, engage young people in the research processes, but we hire a young person onto every one of our research teams. We train them in research methods, and they get human subjects and ethics certifications and so on, and credentials that can be helpful to them in their future as their co-authors in all the reports. And they train us in not only their experience, their lived experience, but also these young people tend to know the systems and the services way better than we do, and our team members do. And so they really are full technical experts and partners in the work, and they're part of our projects. And now we're working to build in permanent full-time staff positions for these young people. So I just want to say that it's really critical to create those opportunities to work closely. Many communities have youth action boards, but making sure that those opportunities for young people to engage are resourced, and that their needs for stability are met. Just because a young person comes into a position of leadership doesn't mean those obstacles go away for them. And also, I think now where the field is evolving is not just paying young people, but trying to find more permanent long-term opportunities for young people, so they're not brought on for a 2-month project and then left high and dry, but that we're looking for pathways and for career development opportunities for these young people to be part of this work and to lead in this work.
That's great. I do love the tie-in to the potential employment and career connection. I can imagine that will make a huge difference for a youth that has this experience, and then be able to apply it to help other youth that are experiencing the same. So really appreciate that. We do have a question about where does healthcare fit in here? I think healthcare providers could play a key role. And this question comes from Jana. And they're just wondering, like, how do we involve healthcare in this as well?
It's a great question. It's a big question. I think there are different ways to answer it. On one level, healthcare is another system, and we could think of behavioral health as well as physical health. And more on the behavioral health side, we're actually learning that some of the highest exit rates out of any system into homelessness for young people are from inpatient behavioral health services. And that's often been neglected. I think people have paid more attention to transitions out of foster care or juvenile criminal justice systems into homelessness. People thought less about transitions out of health systems, whether behavioral health systems or physical health systems, into homelessness. And the same principle should apply there to any other system where we're seeing exits into homelessness. And that is, there should be practices for universal screening and early identification. And it doesn't mean that any one system needs to provide all services for all people, but they should be connected and linked in. They should have their 42 pacers in the community who are tied in through collaboration with them, and have a coordinated care model so that young people are identified if they have housing needs or if they're at risk for running away from home or being kicked out of home in these systems where they're being engaged, and that there is a connection to supports and services in the community. And we also know that many of these young people have medicinal needs or prescription needs, and I've seen some really great models where through collaboration, nurse practitioners can be brought in to run homeless youth programs and shelters and services to make access to those health services much more efficient and more accessible for young people.
Great, thank you so much. There's another question in the chat, and it says many school systems may hesitate to do universal screening for prevention because they're worried about the privacy issues or not having enough resources to support the students. So what could these school systems learn from the experience that happened with Hopkins, for example?
This is really important. So it took a long time for us we've been in conversation with the Australians about their youth homelessness prevention model and school dropout prevention model that they'd started 15 years ago, and they are now just starting to make national scale up of that. And part of the reason it took them so long to scale up, part of the reason it was so challenging for us to find the right communities to start off with, is because there are a lot of knee-jerk reactions to taking this kind of model into schools in the United States. The two that came up most often were actually really related to these two issues. One is we can't conduct surveys in schools, or we can't share educational records because of FERPA or because of PPRA. PPRA applies to surveys. It's a federal legislation. FERPA applies to education records. And I got that often even from school board attorneys who thought you just couldn't do it. And it turned out there's even explicit guidance in the U.S. Department of Education's help desk that says, yes, you can actually do that. There are waivers, there are exceptions for implementing universal screening surveys and for collecting educational data in schools, but you have to meet certain requirements. And what I learned through this process was that leadership mattered so much. And that's why I brought that up in my presentation. And I think this comment came from Commissioner-elect Latondras, who was a school board member who shared this idea initially with the superintendent of Hopkins Public Schools. And the two of them and others saw this as a need and something that was essential to address the overall needs of their students. And so they set a leadership precedent in the school system, and that helped orient others who might naturally bring a risk-averse approach to a new proposition like this to bring a solutions mindset. And that was really essential. So I've learned that when we engage new communities or school systems in this kind of process, it is doable. There are ways through it. And we've now received IRB approvals, and we have FERPA written agreements. We've addressed all these compliance issues. And we've even had sign-offs on our approach from the U.S. Department of Education's FERPA help desk. So technically it's doable, but it really does take leadership to say, this is important to us. This is important to our students. This is important to our families, and we're going to find a way to make it work. And then the other issue that comes up a lot is we can't do this because we don't have enough resources right now for students who are already experiencing homelessness or already in crisis. So why would we do universal screening to identify more students that we don't have enough resources for? And I understand that. I empathize with that concern. At the same time, the answer to not having enough resources to address the need is never to keep the full need under the rug, is to never keep it invisible. We'll never be able to advocate for the resources that we need until we've started to identify these students and to use good data and improve the data that we have on them. So that's answer number one, is that it helps in the longer run to get those resources. And answer number two is that we need to think flexibly about resources. So what we've been able to do is partner with philanthropy and local governments to build in new resources and make sure the schools know that they're not, if they sign up to a model like this isn't their role alone. It's not their job alone. Their role is to help with the universal screening and the care coordination. But we partner with community-based organizations that can deliver case management to students and families and connect them with resources for housing, mental health, substance use, and the other needs and youth development services. So it's that partnership that makes upstream work. It's not any one system thinking they need to shoulder the burden.
You know, this reminds me of a prior question, and I realize we only have a few minutes left, but you talked about the connection that could be made with Greater Minnesota, the schools there. I'm reminded of a principal in Detroit Lakes who has a really high rate of homelessness in his school district, and resources are pretty scarce in that community. And so for those more rural communities or those that don't have the resource rich area of the metro, do you have suggestions for what to do in that situation?
We're having some conversations. We've just published a new report on rural youth homelessness out of Chapin Hall. So I'd encourage everybody to check it out. And I put it in the chat in response to one of Jana's comments as well. I think with rural communities, there are a couple of things. One is that the kind of conventional youth homelessness services and resources often just don't exist. So one is it makes the resources within broader public systems and community organizations even more important. Having those resources for screening and identification, having resources for supports built into those broader public systems is really key. And the other thing is to be thinking about flexible resources. So one of the things that we're doing now in New York City is developing and testing a direct cash transfer program for youth experiencing homelessness. And we're getting a lot of interest from other rural communities in New Hampshire and elsewhere about applying that in their areas, because in these cases, it's even less realistic to expect young people to benefit from residential programs or something that might be 2 hours away from where they are. And so they need even more those flexible resources that can be deployed virtually and remotely to young people. That might include virtual mental health support. There are good models for this that are coming up. It might include direct cash assistance to youth or students or their families. And so thinking about those types of flexible resources that are more cost efficient and can be deployed more flexibly over a wider terrain can be really helpful.
That makes a lot of sense. And I know that technology is a huge piece of being able to connect with youth. So I know that we're getting very close to the end of our session. We have a minute and 30 some seconds left. So I'm just going to thank Dr. Morton for the engaging presentation and discussion today, and to all of you in our audience who participated and hopefully gained a lot of knowledge and ideas from that presentation. Just wanted also to let you know how to exit this session and get into the next session. So you'll see a little red door to the left of your screen, and you're able to exit there, and then you can log in to the next session. There are 2 sessions that follow. You can choose one or the other. One session is actually a follow-up to this presentation where we can talk with a panel that will give us some information about how they're responding to homelessness and making sure that it's a solvable problem. And then there's also a session on a case for administrative data, which will talk about the use of data and ethics in research, specifically using the Minnesota Homeless Management Information System data, as well as other data systems. So you're welcome to exit our session now. Thank you again, Dr. Morton, for this engaging presentation.
Thank you very much.